Good afternoon. Thank you for coming. Today I'd like to talk to you about the pacemaker and ICD. Before that, let me give you a quick introduction of myself. My name is Sean Wang. I've been in the EP lab for the last 6 years as RCES, which stands for Registered Cardiac Electrophysiology Specialist. My main responsibility is to help physicians to implant devices to do cardiac ablation for arrhythmia. Prior to this career, I was in the restaurant business for more than 20 years. And you ask, why is the restaurant guy doing healthcare? Let me tell you what happened. About 10 years ago, my father was gravely ill. And I decided to sell my business to take care of him because I knew it wasn't a short-term commitment. And of course, I did not expect to be 5 years. Even though I did quite well in the restaurant business, I always interested in healthcare. Went back to school, acquired the necessary skill to be in this field. To this day, I have no regrets and I'm happy with this decision that I made. The subject I'd like to talk to you is pacemaker and ICD to provide information to the caregiver, nurses about indications, implant procedure, and post-care for this patient populations. Let me give you a quick outline of this presentation. Here's how the pacemaker and the ICD look like. Pacemaker is the smaller one. ICD, which we need to give a shock to the patient when you need it, therefore comes with a bigger battery and of course a bigger package. I'll pass this along the room so everybody can see the equipment. Then I'll give you indication for the ICD and pacemaker to give you some ideas who needs a pacemaker and who needs ICD. We'll talk about what happens in the EP lab during the procedure. Lastly, I'll explain post-implant care for the patient and what to look for if there is complication due to the procedures. Now let's get started. Heart rhythm is the way your heart beats. Conduction is how electrical impulse travels through our hearts, which causes it to beat. Cardiac conduction system is a group of specialized cardiac muscles cells in the wall of a heart that sends a signal to the heart muscle to cause it to contract. The main component of a cardiac conduction system are SA node, AV node, bundle of His, bundle branches, and Purkinje fiber. SA node is our natural pacemaker that starts a sequence by causing the atrial muscle to contract. From there, signal travel to AV node through bundle of His, down the bundle branch through Purkinje fiber, cause ventricle to contract. Indication for pacemaker. Each year, pacemaker therapy is prescribed to approximately 300,000 persons worldwide. Currently, pacemaker device treats bradycardia, tachycardia. In some cases, combined with ICD implantable defibrillator in older patients. Devices that maintain synchrony between atria and ventricle are preferred because they maintain increased contribution of atrial conduction to ventricle filling response for this age group. In general, rate response are preferred because they are more closely simulate physiological function of our natural rhythm. Which pacing program will be adjusted to your rate response, such as increase if the When pacing program will adjust to your activity, such as rate will increase, the person is excited, and slow down if the person is resting like a normal heart rhythm. Permanent pacemakers are implanted in adults primarily for treatment of indications such as six-sinus syndrome, acquired AV blocks, and vesicular blocks. Is also effective on prevention and treatment of tachycardia and the form of a neurocardiogenic syncope. Bibeat pacing recently have shown to be effective treatment in advanced heart failure patient whose major intraventricular conduction effect, predominant left bundle branch blocks. Many studies have documented that pacemaker therapy can reduce symptoms, improve quality of life. In certain patient population, improve survival, such as shortness of breath, exercise intolerance due to effective heart dysfunction. What's the difference between pacemaker and ICD? Pacemaker helps control abnormal heart rhythms. You use the impulse to prompt the heart to beat normal rate. It can speed up the heart rhythm and control a fast rhythm and coordinate the chamber of the heart. Most of the time, pacemaker will just sit there to sense your rhythm. If it do not sense your atrial rhythm, it'll fire for you. If the device senses the atrial signal but does not sense the ventricular signals, you will fire for it in the ventricular after the atrial signals. Sensing sensitivity and pacing rate will be programmed during in implantation device. ICD, on the other hand, will do everything pacemaker do. Well, ICD will also monitor heart rate. If it's sensing dangerous rhythms such as ventricular tachycardia and ventricular fibrillation, it will deliver a shock to reset your heart rhythm. The treatment is called defibrillation. And ICD can help control life-threatening arrhythmia, especially those that cause sudden cardiac arrest. In other words, heart attack. And this is a simple abbreviated view of how pacemaker look like. It contains a logic board, the sensors, and batteries. The battery takes up more than 60% of bulk of a pacemaker because it has to last a long time. We definitely do not want to replace it every couple of years. Okay, pre-procedure checklist. Fasting of minimum 8 hours before procedure, because pacemaker procedure is considered a minor surgery, because we do use general anesthesia or sedation. It will relax muscle in the digestive tract and airway that might cause food and acid pass from stomach into the lung. Verify all lab results within a normal range, especially INR and platelets is within the range. Because of a bleeding issue during and after surgery. And verify renal functions and diabetes status. Creatinine is denoted for renal function, because contrast is used to locate blood vessel. Contrast is contraindication for renal patient. Monitor the glucose level for a diabetic patient in case patient goes hypoglycemic. Now, this is how the EP lab look like. Patient usually lying flat on table, Monitor will hook up to the monitoring system to monitor all the vitals throughout the case. Here's all the personnel going to be in the case. One person will, one in the corner, one person will record the procedure in the medical recording system. Circulator will drop supplies and the equipment for the team. Scrub will help implant devices. Anesthesia will provide an anesthesia service. And physician. Lastly, pacemaker vendor will supply the pacemaker and program the device during the procedure. Placement of a pacemaker in an ICD. As you can see, there's a pocket open on this patient. The most of the incision for this pocket will be on left side below collarbone. Well, once the pocket is formed, we'll obtain transvenous access to the right heart chamber through subclavian vein or cephalic vein. There are a few techniques for vein access. This particular one is a cut-down procedure. Once vein is exposed, the lead that connects to the heart to the device will be inserted through the vein into the heart. The placement lead, during the procedure, the placement lead will guide it under X-ray. The blue wire that you see on this picture is actually white, but just for presentation purpose, we're using blue so you can see it. And will be inserted to atria and the ventricular positions. And testing and sensitivity will be done at this stage. Make sure it has correct sensitivity and the correct voltage to the heart that it will pace. Once the lead past the threshold and all the tests, the device will be connected and programmed by the vendors. Programming and the testing of the device will be done during the implantation. A different vendor will be present during implantation in order to program the proprietary software and the hardware. Current companies out there to provide equipment are Medtronics, St. Jude, Boston Scientific, and Biotronics. Once pacemaker is in the pocket between the muscle layer and fatty layer, it's usually tied down with a silk or muslin, which is non-dissolvable suture. As you can see on this video, you can see the pacemaker right there. After the device is tied down, 2 additional layers of suture will be used to close the pocket like this. We usually use Vicro 2.0 and 3.0, both of them are dissolvable sutures. Some doctor will staple on the top layer as well. Post-device procedures. After procedure, patient will taken to a PTU for observations. Then to the hospital room, nurse will monitor vital sign. Remind patient to inform the nurse if he or she feels any chest pain or tightness or any other pain at incision site. After the period of bed rest has been completed, the insertion site may be sore and painful. Pain medication may be administered. Once blood pressure and pulse and breathing are stable, patient is alert, he or she will be discharged home. I'll take any question regarding this presentation if you have any. Right, thank you for your time. I'll be getting some insight into a pacemaker and ICD. Thank you again for coming. Have a great day.